Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now. I'm Justin Gould. The Chautauqua County Health Department reported 2 new cases of COVID-19 yesterday. Officials say the cases involve a man and a woman, both in their 40s, and there are now 11 active cases, with patients continuing to recover under quarantine. So far, 8 people have fully recovered and 2 have died. In Cattaraugus County, 2 new cases were reported, bringing the total there to 12 with 9 active. The 11th case is a woman who lives in the southeastern part of the county with no significant travel history. The 12th is a man healthcare worker who lives in the northeastern part of the county that was in close contact with a known positive case. He developed cough, postnasal drip, and fatigue before testing positive. Now later today, Chautauqua County officials are scheduled to hold a COVID-19 press conference update. We'll stream that live right here on WNYNewsNow.com and our Facebook page at 3 o'clock. Well, the Trump administration is targeting early May to reopen society, but that plan could run afoul of advice from medical experts. Athena Jones explains why.
For Governor Andrew Cuomo, it's a tough balance, mourning the loss of thousands of New Yorkers while seeing some positive signs in the decrease of hospitalizations across New York State.
It's an emotional time. It's a stressful time for everyone. It's not going to get better anytime soon. That's the truth. We are flattening the curve. We have to maintain it. But the human cost here, the human toll, the suffering is just incredible.
Early data show Black and Latino people in New York City make up 62% of reported fatalities, although they're only about half of the city's population.
I also believe the frontline workers do have a greater exposure than most people. I think that's one of the things we'll find when we do this research on why is the infection rate higher with the African American community and the Latino community.
A model often cited by the White House suggests coronavirus-related deaths will be lower than initially projected thanks to social distancing.
That is modeled on what America is doing.
Still, Dr. Anthony Fauci reminding Americans the upcoming weeks and months will be extremely tough.
The most striking thing that obviously is so sobering to us is when we see the number of deaths. We know now for sure that the mitigation that we have been doing is having a positive effect, but you don't see it until weeks later.
For the essential workers like first responders and grocery store employees keeping the country going, the CDC issuing new guidelines for those who may get exposed to the coronavirus, saying they can return to their jobs if they are asymptomatic, take their temperature before work, wear a face mask at all times, and practice social distancing.
One of the most important things we can do is keep our critical workforce working.
People familiar with the discussions tell CNN Trump's aides are examining ways to reopen the U.S. economy as soon as May. But officials like California's Governor Gavin Newsom say it's too soon to lift safety guidelines.
While the curve is been bending in the state of California, it's also stretching. And at any moment, if we pull back, you can see that curve go back up.
The nation's top infectious disease doctor agrees.
We need to keep mitigating. We know that this is something that is a strain on the American public, but it's just something that we have, not only the only tool, it's the best tool.
Athena, thank you. The models experts are using to forecast this infection are based on people's social distancing through May. And like most human behavior, that's not so easy to predict. Well, farms remain open as essential businesses during this global COVID-19 pandemic, but the farming industry is struggling. That according to Chautauqua County Executive P.J. Wendell, who discussed the struggles that the 1,200 plus farms here are now facing. He says there's too much milk on the market due to the closure of schools and decline in restaurant sales, causing farms nationwide to start dumping their excess supply.
Please consider buying an extra jug of milk, a block of American-made cheese, or a tub of ice cream. According to the Institute for Food Safety at Cornell University, our food system is secure and there are no legitimate threats of food shortages.
Now, Wendell asks anyone who sees stores limiting dairy products or purchases to call Caitlin Whalen Stoll. She's the business management specialist at Cornell Cooperative Extension of Chautauqua County at 716-640-0522. The number again is 716-640-0522. We have more and that number listed at WNYNewsNow.com and on our mobile app. Well, the Chautauqua County Public Defender's Office is remaining open, but like other essential businesses, have made some changes. The department's offices in Mayville and Jamestown are open to assist those who are in need of urgent legal representation. Legal assistance will also be given by phone or video conference. An online version of its application for representatives is now under development. A day-to-day operation within the courts in New York State are different during this crisis as well. The Office of Court Administration mandated all courts within the state to postpone all non-essential matters for up to 90 days. All courts located in New York and Chautauqua County are temporarily entering only emergency, criminal, family, and surrogate appearances and procedures. The Public Defender's Office also says that defendants and defense attorneys appear more frequently in court via Skype or by phone rather than in person. Well, first responders, city staff, and community members surprised workers at UPMC Chautauqua Hospital this morning with a special salute. Jamestown Mayor Eddie Sundquist says the event was originally put together by the Chautauqua Center as part of a national movement called Heroes for Heroes, where police, fire, and EMS workers show their appreciation for the work nurses and doctors do.
We're all in this together, and that's the thing that we want to try to convey. This is a time where, no matter what's going on, our main priority is saving lives and helping our residents and helping the people in our city. So we wanted to show our healthcare workers that we're here for them, just like they're here for us during this difficult time.
Well, Jamestown police officers, Jamestown firefighters, city council members, city workers, and community members alike gathered outside that hospital at 9 a.m. this morning to show their support. Certainly amazing to see. And those workers, really all of them, are on the front lines. And we here at WNY News Now salute them for their work and thank them for it as well. Well, hopefully all of you are having a good day, and we thank you for joining us as we continue to put facts over fear in regards to the novel coronavirus outbreak and its effects here locally. Got to say hello to Lakeith, Liz, Joseph, Butch. Good afternoon to you, sir. Thanks so much for joining us today. Andrew, Garrett, Derek, good to see you. Kevin, Gwen, Stephen, Chris, Don, Jeremiah, good to see you. Jason, Lori, David, so many of you. Bobby, Pam, Wilson, Cassidy, Donna, Eric, good afternoon to all of you, and we thank you so much for joining us here on the broadcast. Let's switch gears now and get a check of our First Defense weather forecast. That's where Chief Forecaster Dakota Hunter comes in handy. And Dakota, is that snow?
Yeah.
That's snow. I don't like that.
I know. Go ahead, send the hate mail. I know you're going to send it. Just type it out, send it to me, because this is snow, folks. Now, what's very interesting is just a couple days ago, if you looked outside, this was hail. Now we're dealing with snow. What in the world is happening here? Well, we told you about this all week long, and of course, Andrew was here yesterday telling you about this. We had a little light accumulation here at essentially near, that's in Mayville, near Chautauqua Lake, and you can see it here on radar. This was the snow that moved through this morning. We're in a break coverage right now, and man, those snowflakes that fell this morning were big. And I actually shot a video from our parking lot, which I will show you coming up in the full weather segment a little bit later on. But now it's all tapered off and we're in a little bit of a break right now. But the snow is not just the big problem. It is the winds. It's a little windy out there today. 16 miles per hour is the current wind speed right now. This is the average wind speed, not the wind gust. It's 20 in Fredonia, 18 in Clymer, and 13 over in Erie. The wind gusts are ranging about 20 to 30 miles an hour through the day. So when you get one of those, it's going to feel a lot colder out there than it does. We did manage 54 yesterday. That's right where we should be for this time of the year. That's the average high. And 79 and 12 are currently in the record books for this day. So through the afternoon today, any of those snow showers taper off. They're pretty much all gone throughout the area right now. Scattered rain showers will develop, but it tapers late in the day. We may may see a few peaks of sun. I wouldn't count on it, but if you do, consider yourself lucky. Rather cold, quite windy though. 41 to 46 is our high temp range. That's the best we'll do with that west wind, averaging around 15 to 30 miles per hour through the day. Snow continues tonight and tomorrow. More accumulation is on the way. We'll talk about how much in just a few minutes. Justin?
All right, Dakota, thank you very much. Looking forward to it. Coming up, the president of UPMC Chautauqua Hospital, you see there, joins us live to talk more about how his medical center is dealing with the COVID-19 outbreak. Stay with us as WNY News Now at noon continues next.
You're watching WNY News Now, your source for breaking news.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
With coverage that matters, this is WNY News Now.
And welcome back to WNY News Now. Joining us live is Brian Derniak, the president of UPMC Chautauqua Hospital here in Jamestown, to talk more about the COVID-19 outbreak and its effects on his facility. President Derniak, thanks so much for joining us today.
Thank you, Justin. It's my pleasure.
First off, I want to ask, how have preparations been going there at the hospital since this outbreak first took full focus last month?
Well, really, we've done extensive preparations at the hospital. Everything from limiting access to the organization, which is done with the intent to limit the possible transmission of the virus to patients and visitors, to surge planning in case there was a ramp up of inpatient activity, along with doing a lot of work on at the request of the governor and the commissioner of health for the state. Providing them with a lot of information as they were dealing with the uncertainty in New York City. So literally, we have been working on this 7 days a week for the last month to ensure that we're appropriately positioned for any health changes in our community.
Now, last week, a special testing facility was set up at Jones Memorial here. What role does that play, and how has it helped in trying to contain the spread of COVID-19?
Sure. So last Wednesday, we opened an outpatient collection center over at the Jones Hill campus. And really the intent of that is to test people who are showing symptoms that would be associated with COVID. Those patients are in touch with their primary care physician, and they explain what's going on with them, and they're showing respiratory difficulty or the symptoms of a sore throat or and so on. Based on the primary care physician's evaluation, then they write a prescription for that patient to get tested, and that's done via nasal swab. And so the patient is swabbed. The results then are sent to an outside lab. That lab processes the test, then we get the information back. And really what it's doing is it's telling us, where we are as far as the potential penetration of the virus in our community. So the more data we get, the more we know of, is the social distancing working? Are we a potential hotspot? Those type of things. And so it really helps us with our analytics to know what kind of preparations we should be taking.
How is your hospital staff protecting themselves from the virus? I know that the community members now have to call ahead, especially if they're experiencing COVID symptoms. But what other steps are in effect right now to keep them safe?
Well, all of our employees, including myself, are doing mandatory masking. So we all, every day when you come to the hospital, you come into a couple designated entrances, and we're asked a series of questions. I'm asked if I have had any contact with a person who's been known as a positive with COVID. Do I have a fever myself? Do I have a cough or respiratory difficulty? And then I'm actually, they take my temperature with a thermal temperature device and to see if I have a fever. Assuming all those things are no's, then I'm given a mask, which I put on, and then I go to work in my area. So if I'm in any areas where there's outside of my office, I'm wearing a mask. If I go to the cafeteria, if I go up on the floors, and that's the same for all of our physicians, that's the same for all of our employees. We do it with any visitors, any vendors, any patients. We provide that same level of security for everyone.
How is the supply of those masks and other PPE equipment there?
Well, knock on wood, so far, we've been fortunate enough to have appropriate PPE for our employees. One of the benefits of being affiliated with a large health system like UPMC that has 40 plus hospitals is depending on some hospitals are seeing more COVID activity than others. And so those places that are busier, obviously we're routing supplies to them. Those that are less busy may have fewer supplies, but a big system like that, we're able to help each other out. So far, so good for us.
Have any local businesses that shifted their production to things like masks and face shields helped with keeping that supply going?
Well, there's a number of businesses that are actively trying to do those type of things and working to support all the local healthcare providers. So whether it's a UPMC Chautauqua or the nursing homes or whomever it might be, the support from the community has just been outstanding, trying to help us in any way they can.
Now, have any of your hospital staff been affected by the COVID-19 outbreak?
Well, one of the things we do just because of a patient privacy is we wouldn't discuss if we had any of those type of situations. We try to be mindful of those type of things. But, we have a number of protocols in place that if someone did in fact think that they had an exposure, we go through a whole series of things to protect the employees. So we have all kinds of safeguards in place to make sure our employees are well taken care of.
What do those safeguards kind of look like? In addition to the masks, I would imagine if someone did have symptoms coming into work or maybe they developed them throughout the day, you're in a hospital, so it's probably one of the better places to be.
Well, absolutely. So if someone's not feeling well, we tell them to call us in advance. Let us know. We have, an occupational health department that would ask that patient a series of questions to determine, why might they have a sore throat? Why might they have the sniffles? Give them some advice on how to deal with that. Ultimately determine, just stay at home a couple of days and see if you feel better in a few days, or, do we need to do testing, those type of things. So they really handle it on a case by case basis, depending on, what the patient is presenting with.
What do you want the community to know and do now as this outbreak is continuing?
Well, honestly, a lot of great things are already in place that's come down from the governor and the Commissioner Zucker, as well as our local health departments, and that's social distancing. I think that's one of the things that's been very beneficial. It keeps people separated. Wash your hands is great advice, and just continue to follow the directions that are being provided by our health officials. And if they do that, they'll keep themselves safe and keep themselves well. But I'd also say that, to your point earlier, Justin, the hospital is very safe. We're taking every precaution to make sure the building is clean. Our employees are well protected. Coming here, is not going to be a situation where, it's unprotected. And so we want people to understand that we're doing everything we can, that if they need to use our services, we're going to do our best to take good care of them.
And I would imagine then if someone was experiencing symptoms and severe symptoms to the point where they needed to go to the emergency room for COVID treatment, the idea then is still, obviously if they call 911, they would tell the operator that. But if they were just going to drive themselves to the emergency room, should they call the hospital?
Well, it wouldn't hurt to let us know in advance. But, really, when they come into the hospital, they're going to be greeted with staff who are in personal protective equipment. They're going to be, gowned and masked just to be on the safe side. They're going to triage that patient. They're going to ask them what their symptoms are. And, if the symptoms are COVID related, then, we have a whole pathway that we follow to ensure that we take good care of that patient, as well as, keeping other people safe. And, we're going to be on the conservative side. The reality is the COVID symptoms mirror flu symptoms. And, so there's really not a lot of differential between the two. And so, when people have those symptoms, we're going to treat them, in a very cautious manner to make sure we do the right thing for everybody involved.
Now, we've been seeing in some footage that we've been showing, which we shot at the hospital last week, but it looks like the new tent, it's like a yellow containment tent almost, has been set up out by the ambulance bay. What is that used for? And if people were coming in through an ambulance with COVID symptoms, is that for them?
Well, actually, it wasn't. It was something that we were doing just as part of our emergency preparedness drills. We hadn't had that piece of equipment out of storage for a number of years, so we thought that we would take it out and see if it was still functional. But at the end of the day, when we were trying to determine what was the best place to test patients on an outpatient basis, we actually thought a location off the hospital campus made more sense. It would provide easier access for the patients, and it would limit the traffic in the emergency room. So at the end of the day, that's why we chose the Jones Hill campus.
Yeah, certainly. And then finally, we want to thank you so much again for joining us today. But I want to ask you about this pretty cool event that took place this morning with a big show of support from local first responders, officials, and community members alike with that special salute outside. What did that mean to you and your staff?
Well, it meant the world to our staff. Knowing that they have the support of our mayor, along with our first responders, our police, our ambulance professionals, our firefighters, that provided everybody with a real a positive feeling. And you know what? The feelings go mutually both the other way, because we're all in this together. Our police officers are here regularly bringing patients to the hospital or helping us out. Our EMS personnel. The admiration is mutual for the hard work they're doing every day. They're on the front lines as well. So it was as much supporting them as them supporting us, and we genuinely appreciate it.
Absolutely, and that support not wavering no matter what the weather was, because I know I attended this morning and a wonderful display of support amid freezing snow. So certainly goes for hospital officials and for those first responders on the first line, always coming out. Brian Durniak, the president of UPMC Chautauqua Hospital here in Jamestown, joining us today. Sir, we thank you so much for being here on the broadcast and appreciate your time.
Appreciate it. Thank you, Justin.
All right, now let's get a check of our weather with Dakota.
Hey, Justin, and everybody, let's sing it with me. Sleigh bells ring, are you listening? This was in our parking lot this morning as I was coming in. Look at those big fat flakes coming down. Oh yeah, we had that snow this morning, and the snow has tapered off. And as always, if you have any pictures or videos you'd like to send to us, Hunters WX on Twitter, and also the First Defense weather page on Facebook. Andrew and I both had that, and of course we maintain that page very often. Here's a live look right now from downtown. You can't even tell it was snowing. Really no snow accumulation downtown, but a few odd breaks in the cloud cover. We're at 39 right now at the airport with overcast skies. There's that west wind of 16 and there's that wind gust of 22. So when you walk outside, it's feeling a lot colder than that. The wind chill's down to 30 when you combine the air temperature and the average wind speed together. Here's what's coming up. It stays windy this afternoon, but it gets even windier tomorrow, and especially tonight and tomorrow. We're talking wind gusts near 50 miles an hour. I would not be shocked if essentially sometime this afternoon, if the Weather Service pulls the trigger on a wind advisory. Wouldn't be surprised if we see that. We're talking more snow, baby. Yeah. Yeah, I mean, I know you're all excited for that, but it's an overall seasonable time for Easter Sunday. We'll talk about that. Essentially, you'll see that on the 7-day forecast. The radar right now, a lot of the snow is tapered off. This is what's left of it. Just a few little light returns out here, essentially out to the east, going out into Steuben County and Allegheny County. That's pretty much about it. Once we work back towards here, really nothing, but that's the snow that moved through this morning. That obviously created our snowfall that we had this morning. And this snow is basically associated with a strong cold front that moved through. Andrew talked about this yesterday, talking about how that cold front would plow right through, and that's it. Also with the low pressure area, you can see that little spin right there. That's where that low is in association with the cold front. So let's take you through a future scan, newest run here. So you can see here really nothing through the day. Now this particular model tries to paint more snow showers this afternoon. No, it's going to be rain. If we see any more precipitation, it'll be rain. Temperatures are going to go basically above freezing this afternoon. We're already there. And then it will transition back to snow tonight. So again, basically expect snow. The darker blues indicate the heavier amounts of snowfall rates. This will accumulate going into tomorrow morning, and then the snow will continue through the day. Tomorrow, we're talking a couple inches maybe on the hills. The snowfall totals are coming up right now. So let's talk about where the snow is coming up here. So once you work up into the highest hills, you're looking at about 2 to 4 inches. When it comes to snow, we talk about this all the time. Focus on this lowest number, not the highest number. If you get more than the lowest number, that's a bonus. So about 2 to 4 inches, highest hills, 1 to 3 inches across the lower elevations. Once you work right near the immediate Lake Erie shoreline, an inch or so right at the shoreline communities. So this isn't big time epic snow, but it is snow. But again, the average snowfall accumulation for the month is around 2.5 to 3 inches. So it's not uncommon to see snow in early April. Temperatures today, not feeling like April at all. Lower to mid 40s through the afternoon. A few rain showers this afternoon, but maybe a few cloud breaks later on. How about the future? The next 7 days of your life are coming up. We're up to 34 tomorrow. That's the best we'll be able to do, with snow continuing 1 to 3 inches through the day tomorrow. Very cold. The sun will return nicely on Saturday. We're back into the mid 40s. Easter Sunday looking seasonable, but with a few snow showers, with a few rain showers, excuse me, not snow showers. A few rain showers continue into Monday, 56, and here we go again. We're back into the 40s once again with a few rain and snow showers mid next week. News continues 24/7 at WNYNewsNow.com and the mobile app. We'll see you right back here tomorrow at noon. Have a good afternoon.